The monkeypox vaccine rollout has continued to frustrate state officials who say that the feds are not relying on an established system to distribute the vaccine, slowing immunizations and burdening local health departments. Here to discuss is Washington Post health reporter Fenit Nirappil. Welcome, Fenit.
Thanks for having me.
So what on earth is going on? Why multiple years into a previous pandemic are we unable to get these doses out efficiently?
Well, one of the issues, as the New York Times reported, is that we're not using the same system that we did during the coronavirus vaccine rollout with the monkeypox vaccine, and you have different agencies involved in this response. Because one of the tricky things about monkeypox vaccine is we're drawing upon a stockpile of vaccines that were in the national stockpile, and really this was stockpiled in the event of a smallpox outbreak. So the US government has been in this position where they're kind of adjusting on the fly here, trying to respond to a monkeypox outbreak at the scale that they haven't anticipated or that no one in the world has seen before. And they're drawing from a playbook that hasn't really been written up, so they have to adjust here.
Well, part of the criticism, right, though, is that this shouldn't have been unprecedented, that at one time there was a larger stockpile of the monkeypox vaccine in the United States that they let expire because it costs a certain amount of money to maintain the doses as they go, as they expire, rather. And that, moreover, that there were these vaccines that were stockpiled in a European factory that could not be distributed for a period of time because the FDA hadn't basically approved the new factory where they had been manufactured. So there was this sense that there were all of these delays that were not unpreventable, but that were perhaps endemic to the broader public health issues that we've seen exemplified through the COVID rollout. I mean, where are we on all of those kind of supply chain issues in the vaccine?
That's absolutely right. We're seeing repeated missteps made here when we could have had more vaccine stockpiled in an event like this. I've talked to experts who raised the point that, we have such a large defense budget and we have so many systems in place in the event of unlikely attacks on the United States and unlikely war situations, but when it comes to infectious disease threats, the US government tends not to prepare in the same way. So now we're in a position where they have inked deals to get more vaccines coming. We're in a position now that we're supposed to get 7 million new doses by mid-2023, and the US government has authorized this new approach to administering monkeypox vaccines where you inject it on the top layer of skin and you only need 1/5 of a regular dose. So this is a way of expanding the supply, but it's not necessarily a panacea in its own right. Because you have to train staff to administer shots in this special way, you have to procure special needles, and right now you have all different public health agencies all trying to get these new needles, and we have limited data on just how effective this new approach is. In fact, a lot of what's going on with the monkeypox vaccine is kind of an unfolding trial because there's been limited research on clinical outcomes for people who received the JYNNEOS vaccine because we haven't had monkeypox outbreaks in the West before this. So we are learning as we go here with administering monkeypox vaccines.
Yeah, that's part of the critique as well, right? That, this has been a thing that's existed in other parts of the world, but because the argument goes that it's been limited mostly to sub-Saharan Africa, that there just hasn't been the same interest in stockpiling and this belief that this thing called monkeypox could never happen here or can never come here. And that's part of the criticism, right? That the public health response has been affected by a bias about what we perceive to be legitimate threats to us here in the West. You said that they expect to have the larger volume of vaccines by 2023. Is that enough to head off this outbreak at the pass, or are we going to be dealing with surging numbers, the likes of which escape some of the communities to which the outbreak has been relatively limited so far?
So right now we're in a position where the outbreak is predominantly, overwhelmingly in men who have sex with men. The pool of eligible people for vaccination in that group is estimated to be around 1.6 million. So right now we're in a position where we wouldn't be able to fully vaccinate that group until several months from now. And then there's always all the various challenges in vaccines. Just because people are eligible and just because you have the supply doesn't mean you're getting in the shots in the arms of people who need it. So the open question right now is whether we're going to see monkeypox circulate more broadly in the public. So there was an incident a few weeks ago in Illinois where there was a daycare worker who tested positive, and then there were children who were exposed. We don't know if they were exposed by the kind of close contact where monkeypox usually spreads, but they were given vaccines as a precautionary measure, because the vaccines for monkeypox, unlike with coronavirus, they can be administered after someone was exposed in order to prevent them from getting an infection. So as of now with the supply, there is going to be enough down the line to vaccinate eligible men who have sex with men. If it goes more widespread, if we see an explosion on college campuses, for example, we're not necessarily going to be in a position that we can vaccinate broad swaths of Americans. But I should also stress here that the World Health Organization and others say we're not in a position that we need to have a mass vaccination campaign, at least at this point. And even if it does spread more broadly, monkeypox doesn't spread as easily as coronavirus does. It's not airborne. It's not the kind of thing that we're expecting to see absolutely rip throughout the world in a way we did with coronavirus. And because monkeypox spreads through close contact with infected people, we're seeing it spread efficiently now because there's a lot of close contact during sex.
Right.
This is an uncomfortable topic for many areas. You often hear people say monkeypox is not a sexually transmitted disease. To some degree, it's splitting hairs here because close contact happens during sex. What we're seeing is the overwhelming majority of people who are contracting monkeypox in the samples that researchers have been reviewing have reported intimate activity in the weeks leading up to their infections. And so sex provides an ideal environment for monkeypox to spread rapidly in a way it is now, and researchers suspect that's one of the reasons we're seeing monkeypox spread at a faster rate compared to earlier outbreaks.
Yeah, well, to that point, you've been covering how the monkeypox outbreak has exposed healthcare gaps, especially for gay and bisexual men. I'd love to know more about that in this interesting conversation about whether or not to characterize this as a sexually transmitted disease and how much to emphasize that discrete population where it's manifesting most acutely. There are some people who say, I don't want to stigmatize a population, but obviously you also want to be able to focus resources on the population that's most affected.
Absolutely.
What do you think about that?
So the challenge here is to balance the need to warn the susceptible population with the dangers of stigmatizing them. I mean, this isn't a brand new challenge for public health. There's long been diseases disproportionately affecting the gay community, namely HIV and AIDS. So usually the approach that they try to settle on is to get the message out to the most affected communities without necessarily making the message all about them. We're seeing that in the CDC guidance for sexually active people, for example. Their guidance on safe sex during monkeypox doesn't actually use the words men or gay or anything like that. But at the same time, they're releasing data that shows that the overwhelming majority of monkeypox cases are in gay and bisexual men. So what they're trying to do is get that safe sex guidance out to gay men. Having community organizations, influencers spread the word on it so that people know about the opportunities to reduce your exposure by skipping sex parties, by limiting the numbers of partners until you can get vaccinated without necessarily making it all about gay men. At the same time, the reason that you do want to emphasize that the cases are overwhelmingly among gay and bisexual men is because we have limited resources right now. I mean, I hear all the time from people who are worried that they're going to get monkeypox from sitting on a toilet seat or grabbing a glass of water, and that's not how we're seeing monkeypox spread right now. So when you have limited resources available to protect people, you want to get it out to the people who are at highest risk. And then we're also seeing two equity issues here in terms of getting resources for monkeypox to people. One is the equity issue of how gay men are treated by the healthcare system. You often have judgmental doctors. You have doctors and other healthcare professionals who aren't necessarily up to speed on the latest public health threats that are targeting gay men.
Right.
I've talked to so many patients who have to educate their doctors themselves about what monkeypox is and what they should be looking out for and how to get treatments to them. And then within that, you're seeing professional, wealthy, white gay men who are struggling to get access to monkeypox vaccines and to therapeutics. We know in the healthcare system, there's disparities in how people of color and people with lower income receive healthcare. It's even worse for those populations. We are seeing data suggesting racial gaps in vaccinations and access to treatment.
Yeah. Well, Ryan, what do you make of this?
And Fenit, I'm curious what you think the real world harms have been from this approach. So I would guess, and I'm curious for your take on this, that due to word of mouth, a lot of sexually active gay men have become aware that they are at heightened risk of contracting monkeypox. But your point about medical professionals, and that's despite the reticence of public health officials to actually talk about this like we're adults. But I wonder if the biggest impact is on medical professionals, because they're not in chat rooms, they're not getting the word of mouth grapevine knowledge that you're getting if you're a sexually active gay man at this point, and so they might just genuinely not understand, that who's at heightened risk, and so then if they have a gay patient who comes to them, might have to be educated by that patient, which is deplorable because that's the role of public health officials. But so I'm curious, on the ground, from your perspective, what has been the actual consequences of this reticence among public health officials to talk about this?
So in the clinical guidance that public health officials provide to doctors, they are spelling out that it's gay and bisexual men who are high risk for monkeypox. But that said, there's a lot that doctors have to keep up with in terms of rising public health threats and diseases that are circulating. So in one sense, it is understandable that it's hard for people who are in the healthcare industry, especially those who've been exhausted after 2.5 years of pandemic life, to be keeping up with everything. But on the other side, monkeypox is one of the few public health emergencies that have been declared in recent years, and it is a virus that's spreading through the gay community, and a failure to keep up with the viral threats that are disproportionately affecting the gay community does have real-world consequences, and I'm hearing that in the interviews with gay men who are talking about symptoms of monkeypox that feel like they're passing shards of glass when they're going through the bathroom. And so it is important to get the word out to medical professionals. And this is one of the binds that we're in, is that there's only so much value in the general public knowing that this is disproportionately concentrated in gay and bisexual men, because we are seeing this used as a weapon against gay people and as something to embolden homophobia. Here in Washington, D.C., there was an incident where a gay couple was attacked on the streets and called monkeypox and the F word while they were being attacked. That said, there's always hate against gay people, and I've talked to many gay activists who say, like, monkeypox is just another excuse that people who are already showing hate are gonna seize on to continue being hateful. What's important is to get the word out to gay and bisexual men about a threat that they are living with and want to avoid.
Well, Fenit, thank you so much for taking the time to join us in studio today.
Thanks for having me.
And we will have more Rising for you right after this.